How are you?
Oh, just hanging in there.
It's been a challenge, but what about concussion patients? How productive is it to
Um,
actually continue their care through
yeah,
telehealth?
yeah, really, really productive. I've even started some patients with telehealth via who have concussions, and every week I've been able to progress their exercises and help them. Even just like you said, strategies for wellness during this challenging time, and people have time to do the exercises. So I'm finding people are kind of flying through. So we're really creative. I had one patient use some mouthwash as her visual tracking. It's just being really creative. I was able to help one of my patients. She got hit on the driver's side by a semi. And so she had a lot of balance and vision and even worse in neck pain. And I've been able to meet with her and progressing her balance and getting her more functional, and her neck pain's almost gone, headaches are gone, vision's better. So it is much better of an option than just stopping therapy altogether.
Is relapse the biggest threat, or is it just not having continued progress? Because time is such a big factor in recovery of a concussion, I assume, but also having productive days, productive weeks. If someone went 3 weeks, can they often slip back fully, or is it they become more symptomatic?
Yeah, kind of both. You don't want to just stop the running because you're retraining the neurons and the motor control, and you just want to keep progressing to the next step until we can get 100% functional. But there's also this huge emotional piece, and we see this a lot during the holidays with the overstimulation. There's just a lot of emotions going on. Some of my patients have lost their jobs and they don't have an income, and they're very isolated, or they don't have any family support, so they're just by themselves in their homes right now. And so that emotional piece kind of zaps the brain battery that we say. So that I would expect would set most of my concussion patients back, but the people I've been able to continue with telehealth are still doing better every week I've talked to them. This is temporary, and you need to tell your nervous system that, deep breathing strategies and self-talking and going for walks or doing some yoga, but tell your body that it's going to be okay, because it's not going to be like this forever. So
Because we have concussion patients, and they often are very high functioning, and then they struggle at work, or they struggle. You always hear in sports where they want them to physically be decreasing their activity, but also the mental capability is affected. Where what about in a time like this, even though they're home, and it should be in a weird way less stressful, because when's the last time we all had a month to sit around, but how does stress play into that? Does your brain become more sensitive and you become less tolerant to other types of stress?
I think it's very patient specific, but mostly the stress, the more stress, the worse the symptoms are. So,
Okay.
Lost job, don't have an income, my balance is worse, my vision is worse, the brain isn't balancing. So now one stressor causes the other one to kind of amplify a lot, actually.
Okay.
So be able to control what they can control, because some of the monetary situation is not in their control. Even telling people about resources for unemployment, and just telling people what resources are out there for them right now. I think just talking to people and knowing that they know they're not the only one, but that they can still control their concussion rehab.
What about often it's overstimulation, hypersensitivity, overwhelming type stressors on the system? What about hypostimulation, inactivity? So many people function at a high level of stress, whether you have kids or your job or whatever situation, and then you're stuck in your house or your apartment or your room by yourself doing whatever you're doing. How does decreased stimulation affect someone? Is it a healing effect where they actually feel worse? Just like cleaning up a diet, you often feel like crap but it's a good change. Do you actually, are they healing in a way, but they don't feel better?
I would say it's probably more detrimental to concussion rehab because we want the brain to be exposed to certain stimulus so that it learns how to kind of deal and reprocess the information again. So staying inside all day and like the dark is going to set people back and not allow them to refire those neurons. But yes, just being outside, like, and getting some sunshine or going get some fresh air.
Some interaction with the world is still healthy.
Interaction, yes, would be still healthy. I think there's just so much fear as to like getting the sickness, the coronavirus, that people are, that fear is driving them to be very isolated.
We have months of struggling here, but a few more weeks of really being stuck at home. What is a concussion patient? What should they do?
Well, if they haven't been evaluated, get an evaluation, get a treatment plan, have some direction in how to heal. One patient I had, we started through telehealth, and she just really didn't know that this dizziness and balance and the blurry vision and that all these symptoms were, still from her concussion, even though it was, a while ago. So just giving information and reaching out to resources. My daughter actually had some concussions, and she was diagnosed with ADHD, I believe, as a result of those concussions. And so I've really been able to see her struggles, which I don't know I would see before in the home setting, as far as like not being able to pay attention with like noise around her and her brother. She has to wear her earphones. We have to definitely work hard. So it's been kind of a blessing to see how she's doing and what she needs help with, because the school has done a really good job of making like a plan for her.
I'm going to call you again next week, and
Okay.
I have more questions for you. But thank you for taking my appointment and my call.